Hey, hello everyone, and welcome to yet another True Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the True Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Do subscribe to our YouTube channel. You can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the True Talk, I have Dr. R M Lalitha. To give you all a brief introduction about Dr. Lalitha, Dr. R M Lalitha is an oral and maxillofacial surgeon with special interest in the study and treatment of oral cancer. She is a graduate from the prestigious Government Dental College, Bangalore, and she served as a professor and the head of the Department of Oral and Maxillofacial Surgery from the M.S. Ramaiah Institute of Applied Dental Sciences. With over more than 30 years of experience in major oral surgical procedures and oral cancer, Dr. Lalitha is a pioneer in her field. She has several state, national, and international research papers published. Most of her research papers revolve around oral cancer. She has been a guest speaker in several national and international platforms. She has conducted several dental camps and workshops on oral cancer. Dr. Lalitha has served as guide for several young research scholars and postgraduates in their theses and research publications. She is a member of the IDA, Association of the Oral and Maxillofacial Surgeons of India, and the Karnataka Cancer Society. Dr. Lalitha has been awarded with the Raga's Women Achiever Award of the Month by the Guild of Women Achievers, Best Paper Award for her research papers, T.C. White Scholarship for the year 2002 from India, from the Royal College of Surgeons, Glasgow, Scotland, for advanced training in maxillofacial surgery. Ma'am, thank you so much and welcome to yet another True Talk with your dentist conversation.
Thank you, Dr. Rekha, for the warm introduction. Good afternoon.
Ma'am, what is the topic that you would like to talk about and share with our patients today?
Today, I would like to share my knowledge on oral submucous fibrosis. So, oral submucous fibrosis is a condition in the mouth. So, I thought I will share my views on oral submucous fibrosis today.
Okay, so what exactly is this submucous fibrosis?
Submucous fibrosis means fibrosis of the soft tissues of the mouth. As you
That
all
means
know, yeah,
that means it's like hardening of the soft tissues. That is where the cheeks and all are really soft to feel. It becomes
yeah,
a little more hardened.
yeah, it becomes very firm and woody. So it
Hmm.
is fibrosed. So
Hmm.
as we all know, our mucosa has and the soft tissues have certain amount of elasticity. So when we open and close the mouth and all, we can feel the cheeks moving, isn't it? So the submucous fibrosis means beneath the mucous membrane, whatever the tissues are present, they become very hard and fibrosed. So that is why the name oral submucous fibrosis.
So
It
why
not
exactly does?
only it not only involves the cheek, but also the gums, the tongue, the floor of the mouth, the palate, soft palate, everywhere it occurs. So the entire soft tissue of the mouth becomes fibrosis, hence the name oral submucous fibrosis.
So
So,
what causes this kind of hardening or the tissues losing its elasticity and softness?
well, the most common cause attributed to this condition is tobacco. Tobacco in non smoking form, that is, smokeless tobacco, which is used in the form of chewing tobacco as well as pan masalas. The pan masala is mainly attributed to be a cause for oral submucous fibrosis, and somewhere some give the cause as spicy food. So in certain areas in India where they chew or eat very spicy food, there also certain people get this condition. and also few people get this without any cause. So there we don't know what is the cause exactly. So the main cause attributed in today's life is pan masala, because pan masala, though they claim that they do not contain tobacco, it does contain tobacco in powdered form and various flavoring agents, and some contents are exactly not known. So these are very harmful to our mouth and soft tissues. So it causes submucous
So,
fibrosis.
so if we have a person who is being who's been a constant user of the tobacco in this form, how will the patient know that he is developing this condition? What are the symptoms that show that he's
Yeah,
developing this condition?
first he comes with burning mouth, and then his mouth opening gradually reduces. So he cannot is open his mouth widely, and then he can feel hardening of the tissues, and he cannot stretch the tongue out. And then the entire oral mucosa will have a blanched appearance, and
Hmm.
sometimes he'll have saliva drooling also. So
Okay.
the patient, though he claims he don't know what is happening in his mouth, they come to us with the main complaint is inability to open the mouth
Open the mouth.
widely. So
So, so ma'am,
in
I
our
think
dental terminology, we call it trismus or partial trismus. They come to us when they start feeling that they cannot open the mouth widely and they cannot chew properly. They will come to us in that stage.
so, ma'am, generally when a patient comes to you at this stage, it is we consider it to be a more advanced stage of the condition because
Yeah. When we do have 4 stages because we measure the mouth opening in centimeters. So there is a definite classification for that, but I'm not going to into details with that. But when he does have minimum mouth opening and maximum mouth opening, so sometimes it will be one finger breadth, two finger breadth, three finger breadth. Three finger breadths means it is almost normal, we can say. So when it is reduced, it will become two finger breadth, and still reduced means one finger breadth, and total trismus means he will be completely unable to open the mouth. So we have seen patients what you call as advanced stages. They cannot open the mouth completely. They are having trismus. So when we have a proper medical history and personal history, and we come to know they are gudka chewers or pan masala chewers or tobacco chewers, then immediately our diagnosis can be made on the spot.
so, ma'am, although we would clinically and with the history that the patient gives that he has been a tobacco chewer, we can come to
Mm.
a conclusion that there is a condition which is starting like this. But are there
Yes.
any diagnostic tests specifically that we would do or ask the patient to get done to confirm this?
No, mostly it is clinical examination only. But nowadays, if there is a proper facility like an oral and maxillofacial surgery setup, biopsy can be done to confirm the diagnosis. And also, some patients come with some suspicious lesions on this submucous fibrosis, maybe a red patch or a erythematous area or a white patch. Then we have to suspect something is there, and then we do take a biopsy to rule out malignancy also, in addition to this submucous fibrosis.
So,
Sometimes to document the condition and confirm the diagnosis, we do take biopsy from the lesion and confirm it with histopathology.
okay, okay. So that means to say more or less with what the symptoms and the history the patient gives, we can confirm the condition. But we would
Yes.
also do some lab tests if further
Mm.
confirmation is required. about the condition being going to the next stage, or if it is still in the submucous fibrosis stage.
Yes,
So,
yes.
so, ma'am, is this condition treatable? Is it possible to treat a patient who has already developed this condition because of his habits?
Yes, definitely. The first step would be to de-addict him from the habit, number one. Number two is counsel him about the habit and its effects he has sustained due to the constant use of that particular habit forming uh, tobacco. And also, the third step would be to do a general physical examination and a few hematological examination. And then with this step, we would go ahead to treat him either locally or surgically. Locally means we do give some injections into the fibrosed areas of the mouth, and
So,
this is called intralesional injections or intralesional drug delivery.
okay. So if the patient generally undergoes a treatment, approximately how long does he have to undergo a treatment to correct this condition?
I am afraid they have to take a long term treatment only because these intralesional injections they give temporary relief from burning and mouth opening reliefs, but usually it takes 6 weeks. Like we give the injection sometimes twice a week or weekly once, and then followed by once in 15 days and once a month. And in addition, we do give them certain antioxidants which are now available in the market, which help in releasing the dissolving the fibrous areas. So lot of research is being going on these drugs, and we have also been part of it. And then we supplement them with these oral drugs. And then if the response is not very good, then
Good.
we do understand depending on their requirement, we advise them to go in for surgery.
Okay. So, ma'am, what happens? Suppose at any stage the treatment is given either only with injections, or possibly if a surgery needs to be done, a surgery is done. Is this condition reversible? In the sense, will it come back? Will it?
No, the problem with this submucous fibrosis, the injection, the relief will be only symptomatic relief they will get. Okay. And even the oral administration of certain drugs also, it is not very well established. Like if you have a toothache, you will give an anti-inflammatory or an NSAID, then your pain will be relieved. It's not like that. So it will only alter the condition, but the fibrosis per se will not be reversible. Okay. So we can see some amount of changes in the form of better mouth opening. That is what we want to achieve.
So,
And also, when we do surgery, we have to surgically resect the fibers, and then we have to graft it with many things like synthetic skin, like collagen is available in the market. Or earlier, I used to do thigh skin graft. Also, sometimes we use the buccal pad of fat and then cover it with skin graft or collagen. This is the protocol we are following. And sometimes some surgeons also follow it up with coronoidectomy. So the patients, depending on the requirement, we decide upon coronoidectomy also.
so,
So
ma'am, you said that sometimes this condition can have a red or a white patch on it, which
yes,
means
yes,
the possibility of this condition, which is not exactly a cancer as such, but there is a possibility of this becoming a full-fledged cancer in the future if the
Yes,
patient does not stop using tobacco and tobacco products as such.
yes. That is why we classify this condition. Oral submucous fibrosis come under oral potentially malignant disorder. That means this condition is more likely to develop a cancer than its normal counterpart. That is the exact meaning. So earlier we used to call as pre-malignant condition and pre-malignant lesion. Now the World Health Organization has classified it as oral potentially malignant disorder. So that is the risk they are having. So we have to educate them. If you don't stop your habit and if you're not getting treated or intervened immediately, you have a risk of developing full-fledged oral cancer. Very
So,
important.
so also, ma'am, it becomes really important that if a patient has had a problem and he has undergone treatment to the fully recommended time, like however long the oral surgeon recommends a treatment and he undergoes the treatment, it is best that the patient has to come for a follow-up, say every 6 months, to
Yes,
ensure
yes.
and see that the condition has not progressed into another stage.
Yes, definitely. We follow them up once in 3 to 6 months, depending on their
Condition.
availability of resources and where they stay, because many of them come from different areas, rural areas. So we sometimes give that letter to the common dentist also, and then give them clue on when to refer to us back. So preferable follow-up, like you said, once in 6 months is very
Very important. Very important. So I think, ma'am, the best advice you could give our patients is to stay away from these kind of tobacco and tobacco-related products to safeguard
yes,
the health of the mouth.
yes, because the tobacco, in addition with arecanut and then flavors, they form some sort of a powder like a masala. So this is very habit forming, and though they claim that it is de-stressing them. So I want to tell you one more thing. Important thing is these the people who do this or get into this habit are high-strung people like drivers, jewelers, and young people, laborers, because these masalas are available over the counter very easily and it is very cheap also. So it is very difficult to educate the masses about this condition. I'm glad you took up this topic. So I always try to educate the masses about the harmfulness of this tobacco and tobacco related products like pan masalas. So we should educate the youth and the elderly also who get into such habit formed uh, uh, chewable tobacco and all that. And then this condition, sometimes I tell them, you listen to advertisements where they claim that it doesn't contain tobacco. You go and tell them that this happened to me. So
I know.
it is very difficult. Even if God comes, it's very difficult for me to open the mouth. It becomes so hard. It is wooden hard. Like
Yes.
imagine such a soft and supple mucosa
Yes.
becomes like a wood. So
Yes.
still they don't go to a dentist. So I also tell the importance of going to a dentist once in 6 months.
6 months.
In addition to getting their teeth checked, they also should get mm,
Full mouth
oral
evaluation
surgery
done.
evaluated when they have particular habit.
So, ma'am, Dr. Lalitha, thank you so much for joining me today and sharing your experience and knowledge on a condition like submucous fibrosis. Thank you so much.
Thank you, Ma. Thank you, Rika.
That was Dr. R M Lalitha, oral surgeon, who did share with us all her experience on a condition called submucous fibrosis. I hope that talk was helpful. Please do spread this knowledge among people that you know who are into the use of tobacco and tobacco related products. If you have any doubts or queries, please do write to us below in the comment section and we will get back to you. Any one of you wants to contact Dr. Lalitha, her contact details are given below in the description box. And till another time, I come back with another dentist with another topic on your oral and dental health. Keep smiling, stay safe, and be happy. Thank you.